You know, when we talk about improving global health, it's easy to feel, well, a little overwhelmed, right? The scale of it is just massive. But what if I told you we already have concrete proof that we can make absolutely incredible progress? Okay, let's dive in. We're going to break down the global blueprint for a healthier world, Sustainable Development Goal 3. So, check this out. This one number, it really sets the stage for everything we're about to talk about. In just the last 15 years, the number of childhood deaths around the world has been cut in half. That's right, half. Think about that. That is a staggering achievement. And believe me, it didn't happen by accident. It's the result of focused, coordinated effort. And that progress leads us to this quote, which is just so powerful. It's not just some hopeful statement or a nice wish. It's a conclusion based on real-world results. It proves that with a smart plan and the will to see it through, even the most difficult health challenges are beatable. Which brings us to the plan itself. So what exactly is this global mission for health? Well, officially, it's called Sustainable Development Goal 3, or SDG3 for short. It's one of 17 major goals set by the United Nations to basically create a better, fairer world by 2030. And this one is all about our health and our collective well-being. Here it is, the official definition. Ensure healthy lives and promote well-being for all at all ages. Now, the keywords there are for all and at all ages. This isn't just about fighting one specific disease or helping one particular country. Nope, this is a promise, a universal commitment to everyone, everywhere, from the second they're born to their very last day. Now, a goal this huge, you can't just wing it, right? You need a solid strategy. So, to make it all manageable, Goal 3 is actually built on 3 core pillars. You can think of it like a blueprint for global well-being, where each pillar supports the others to build something really strong and lasting. First up, Pillar 1. This is all about protecting the people who need it most. The strategy starts at the very beginning of life, focusing on the health of mothers, children, and families. And that's so smart, because if you get that foundation right, the positive effects just ripple outwards for generations to come. And this pillar isn't just a vague idea. It has really clear targets. We're talking about making childbirth much safer for mothers everywhere. We're talking about ending the absolute tragedy of children dying from things we know how to prevent. And it's about making sure everyone has access to sexual and reproductive health care. These are just fundamental to human dignity. Okay, let's move on to the second pillar. This one zooms out a bit. It expands the focus from protecting the most vulnerable to fighting the huge health threats that affect whole populations. We're talking about the infectious diseases we all know about, but also those silent epidemics that are quietly growing all around the world. So this pillar has this really critical two-pronged attack. On one side, you've got the ongoing fight against major communicable diseases like AIDS, tuberculosis, and malaria. But on the other side, it tackles the huge rise of non-communicable diseases, things like heart disease and diabetes. And so importantly, it puts mental health and substance abuse treatment right there on the same level. It's a really modern, holistic way of looking at public health. And now for the final pillar. And you could argue this is the one that holds the whole thing together, because it recognizes a simple truth. Having a cure is useless if you can't get it to the person who needs it. You have to have strong, resilient health systems to deliver that care to everyone consistently and affordably. So what does that stronger system actually look like? Well, it means universal health coverage so that getting sick doesn't mean going broke. It means investing in research to get affordable vaccines and medicines to everyone. It means properly funding healthcare and supporting our incredible doctors and nurses. And, maybe now more than ever, it means building better early warning systems so we're ready for the next global health crisis. Okay, so that's the big global blueprint. But I get it. It can feel a little distant, right? Like, what does this have to do with me? Well, the great thing about Goal 3 is that it connects directly to our own lives. This plan isn't just for governments and big organizations, it's for all of us. So what can you actually do? Well, the source material lays out some wonderfully simple yet incredibly powerful actions. You can find and support a charity that's doing this work on the ground. You can vaccinate yourself and your family, which protects not just you, but your whole community. You can register as an organ donor. You can donate blood. These aren't small things. They are tangible acts of public health that, when we all do them, make a massive, life-saving difference. So, as we wrap this up, it really all comes back to this one question. We've seen the proof that huge progress isn't just a dream. It's possible. We've walked through the three-pillar blueprint for making it happen, and we've seen how our own personal actions fit right into that global plan. The only question left is, what's your next healthy action going to be?